Good morning and welcome to the Thursday, October 27th, Washington State Department of Health Media Briefing. I'm Nikki Ostergaard, your facilitator for this event. I'd like to welcome our panelists for the day. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Dr. Tao Sheng Quanget, Chief Science Officer, and Lacey M. Fehrenbach, Chief of Prevention, Safety, and Health. To begin with today's briefing, we'll open with remarks from Secretary of Health, Dr. Umair Shah.
Thanks, Nikki. Can you hear me okay?
We can hear you. Go ahead.
Great. Well, I want to thank our team for supporting us during this briefing, this media briefing that we continue to update our community on various things that are happening across the system. I also want to thank our media partners who are here today. As always, we very much appreciate everything that you do. Let me start by recognizing that October is Breast Cancer Awareness Month. And if I could have the team just put up this slide, we know that every 2 minutes, a woman is diagnosed with breast cancer in the US. We also know that breast cancer can affect men as well. This is a time to recognize all who have battled and continue to battle this disease. And we have made a tremendous amount of progress when it comes to raising awareness, screening, therapies, medical advances, but there's so much work to be done. In Washington, breast cancer remains the most common cancer that affects women. It is also the second leading cause of cancer death among women as well. And health inequities continue to persist. I hope we will continue to come together to raise awareness and work toward community solutions to close gaps and continue to fight this largely preventable disease. You can absolutely find more information on our website about our program that helps to alleviate some of those costs, especially for individuals in our communities who are concerned about cost related to their screenings. Now let me move into a few other topics for today's briefing. I'm joined by Dr. Tao Quanget, who's going to give an update on COVID-19, RSV, and MPV, as well as Lacey Fehrenbach, who will provide an update on both flu and COVID-19 vaccine status in our state. As you know, this continues to be a challenging time for all of us as we face the upcoming respiratory virus season. And I know while we are all concerned about what may lie ahead, we're nowhere where things were the last 2 years or even last year. I cannot say enough about life as we know it returning to normal or the new normal, but we know that COVID-19 is still impacting us and those around us. And we have uncertainties related to what lies ahead. But one thing we do know for sure is that when we come together, there is nothing we as Washingtonians cannot accomplish. So our message is very clear right now. The time is now to get your flu shot, your COVID-19 vaccine, or your COVID-19 booster. We have to do everything we can to get ready for the upcoming respiratory season, to protect ourselves, those around us, our loved ones, and ultimately also to help protect our healthcare system, which continues to be stressed and strained by the challenges of taking care of people across our communities. Let me segue into October 31st. As you all know, Monday is October 31st this year. It's important for two reasons. First, it's Halloween. We're glad that we're at a point where we can begin to enjoy it together in a way that we could not the last 2 years. I can, okay, see the slide now. However, we want to make sure that people remember to be careful around crowds, large groups, especially if you're gathering indoors, to use hand sanitizer as much as possible, especially if you're out and about. If you're sick with symptoms or you are concerned about exposure to COVID-19 or flu or some other respiratory disease, then you really consider sitting this one out. Get tested for COVID-19 and flu. Check with your healthcare provider. Please stay home. We want to make sure we do not spread illness across our communities. We also want to make sure kids and adults alike are safe as they're walking, staying on sidewalks. Obviously, be careful when you're driving. We want all candy gathering trick-or-treaters in our communities to be safe. Please watch out for each other. And remember, if you wear a mask, for your costume, unless it's the right one, it's not going to protect you against respiratory illness. So just keep these kinds of pointers in mind as you are working with your families, your kids, to be safe and protected this Halloween, which was also, these are some of the tips that we have on our website, and I hope you will have an opportunity to visit our website and share some of this information with your communities. This Monday also marks the governor's end of the state of emergency in our state. This, as we all know, is such an important milestone for us. We wanted to clarify what this means for the Secretary of Health's face covering order. On November 1st, just as it stands today, the current requirements for face coverings will remain in effect in healthcare and correctional settings. However, we are actively reviewing and determining in which situations they will continue to apply and plan to come back in mid-November with updates. October 31st also marks the end of WASSERVE, a program that enlisted countless numbers of medical personnel to volunteer to help our healthcare system and our communities out over the last 2 years. Ultimately, 28,000 volunteers answered the call to help at 585 healthcare facilities throughout Washington. With the program ending, all of us at Department of Health, as well as across our state, want to personally thank all of the volunteers who stepped up and stepped in on behalf of communities throughout this great state of ours. So what lies ahead? What are we looking at as Department of Health? Well, you're going to hear more from Dr. Quanget and Lacey as they talk through what we're watching for COVID-19 and flu season and everything else that public health continues to be handling. I cannot emphasize enough the importance of getting your COVID-19 bivalent booster and your flu shot. This Friday, I was in Ellensburg, joined by Representative Kim Schreier. I wanted to thank her, as well as the Kittitas Health Director and Health Officer, Chelsea Loafers, and Dr. Mark Larson, who were administering COVID and flu vaccine at a drive-through clinic that day. I believe they told me that they had over 600 individuals that they had provided vaccine to, which is just an amazing amount. It was great seeing hundreds of community members rolling up their sleeves and getting their COVID-19 or flu vaccines. But at the same time, and you see on the right, by the way, that's an image of Representative Schreier, in this case, Dr. Schreier, giving a vaccine to Chelsea, who had requested that she give her vaccine that day at the clinic. On the left, there is an image here as well. This is an image or a photo that was taken at our Department of Health Caravan event that was taking place at the same time at Central Washington University. And here I met a CWU student named Olin there. And I will tell you, he at that time was there because he was receiving his bivalent booster shot, but wasn't able to get his flu shot. So I asked him to promise me he would get his flu shot on Monday and to email me. So I know that he did it. I wasn't exactly sure he was going to fill that promise because, you know, sometimes students get busy with studies and other things. But he said, no, I promise and I'm going to do it. And I'm happy to report not only did he get his flu shot on that Monday, this past Monday, but he emailed me right after. I have more people will roll up their sleeves like Olin and others in Ellensburg, as well as at CWU, and other students, as well as our seniors are going to get their COVID-19 boosters and their flu shots. And remember, you can even get them the same day. We know that flu season is officially here. Not only are we seeing people get sick with influenza, and right now it appears mostly to be influenza A, but we are sad to report that we have had our first 2 lab confirmed deaths for the 22-23 flu season. Now, this is a reminder that flu remains deadly. Please, this is the time to protect yourself. There are some 180 million doses of flu vaccine that are projected to be available across the country. We have enough flu vaccine in our country and in our state as well. So let that not be the reason that people do not protect themselves or their loved ones. Get your flu shot today. Local pharmacies, your healthcare provider, community clinics, and others continue, including pop-up clinics, continue to provide flu vaccine in our communities. The only thing we ask is that you check if they are taking walk-ins or if you need an appointment, because sometimes you may need an appointment for your flu vaccine. Now, reminder with COVID vaccine that you can continue to call 1-833-VAX-HELP at our Department of Health call line, or go to our vaccine locator to get information on where you can get your COVID vaccine. Let me close by making a comment about the 33rd annual Centennial Accord that was hosted by the Tulalip tribe this week. It was such an honor to be with Governor Inslee, our fellow state cabinet agencies, and tribal leaders from across the state to listen to their concerns as they told the stories about what is happening in their communities. We have appreciated throughout the pandemic, when vaccines were available, how tribes stepped up to help vaccinate their members, as well as making sure they were also helping vaccinate community members around their tribes with COVID-19 vaccine. We, as a state, honored our commitments to them, and they stepped up time and time again. I can't say enough about that. But what it reminded me again is that we are all in this together. Our journey has been a long one, but it continues. Please join us in protecting yourself and each other as we move ahead this fall, winter respiratory season, and absolutely make sure you please get your flu shot. And absolutely, if you are eligible, please get your COVID booster. And with that, Nikki, I will turn it back to you.
Thank you, Secretary Shaw. Next, we'll hear from Chief Science Officer, Dr. Kao Sheng Kwangget. Go ahead, Dr. Kwangget.
Thanks, Nikki, and good morning, everybody. This morning, I'll provide an update on monkeypox virus, or MPV, COVID-19, and RSV in our state. So let's start with MPV. As of October 26th, in Washington, there have been 621 reported cases in 22 counties. King County has the most reported cases, with nearly 80% of confirmed cases. And the next highest counties are Pierce County and Snohomish County. In the past 7 days, there have been 5 new cases reported statewide. And throughout the outbreak, the majority of cases have been in people who identify as male at birth between the ages of 18 and 54 years. Current epidemiology indicates that the outbreak is continuing to wane, though it is too early to be confident that it is ending. Therefore, the Department of Health is continuing our current MPV control efforts in partnership with local and tribal public health. And though our goal is elimination of MPV, it is likely that we will continue to see MPV cases for the foreseeable future as we monitor MPV trends nationally and globally. It's important to remember that though this outbreak is disproportionately affecting the LGBTQ community, particularly gay, bisexual, and other men who have sex with men, that anyone can get MPV. Vaccination remains one of our key control efforts for MPV. The vaccine is not recommended for the general public. It is recommended for those who have been exposed to MPV and those who are at high risk of being infected with MPV. As of October 26th, more than 24,000 doses of Jynneos vaccine have been administered, and nearly 8,000 people are now fully vaccinated for MPV. Our priority continues to be focused on increased vaccine uptake among those at high risk for infection, particularly to marginalized communities, and creating low barrier access for those individuals. This effort hopefully will be supported by a new federal vaccine equity pilot program, which offers additional vaccine allocation to innovative programs aimed at reaching underserved and hard-hit communities. DOH is engaging with partners on opportunities to increase equitable vaccine delivery through this pilot and expects to submit several applications by the end of this week. All of us at DOH are committed to equity and increasing access to vaccine, and we're hopeful for the future as MPV cases continue to be slowing. However, it's critical that we not be complacent. If you have a rash that you think might be MPV, keep your rash covered and see your healthcare provider, regardless of your age, gender, race, or sexual orientation. And if you're at high risk of getting MPV, get vaccinated. Now I'd like to turn to COVID-19. We've made a lot of progress against COVID-19, but we can't let our guard down now. Except for a bump in cases in September, cases have been trending down since midsummer. Currently, we are seeing substantial or moderate rates of COVID infection across Washington state. We don't have a way of predicting COVID-19 activity, but we need to prepare for the likelihood of another wave of COVID-19 this winter. In fact, some European countries have seen a rise in cases in the last few weeks, and the same could happen here in the United States. And this is due to a combination of factors. One is, as more people gather indoors in the cold winter months, transmission is more likely. Another factor is that new, more transmissible subvariants are continually appearing, and it's possible that one could become the new dominant strain and cause a new wave. And finally, as immunity from vaccination and past infection wane, it's possible that people could be more susceptible to COVID-19. And that's why it's so important to get the new updated booster. And Lacey Fehrenbach will be telling us more about the booster in a few moments. It's also important to remember that, that vaccines are not our only tool against COVID-19. Masks are no longer required in most spaces, but it's a good idea to consider wearing a mask when you're in a crowded place or somewhere with poor ventilation, or around people who have chronic conditions or immune compromise that place them at high risk for hospitalization or death from COVID-19. Take the COVID-19 test if you have symptoms and stay home if you're sick, and also consider testing if you're going to a large event or if you're going to be around people at high risk of severe illness. And especially when you're indoors, keep your distance when you're around others. Another respiratory illness that we want to talk about this morning is respiratory syncytial virus, or RSV. And this is already spreading nationally as well as here in Washington. Symptoms are quite varied and can mimic a cold or upper respiratory infection. And this includes runny nose, coughing, sneezing, wheezing, fever, and a decrease in appetite, particularly for infants. These symptoms usually appear progressively in stages and not all at once. In very young infants, common symptoms can be irritability, decreased feeding and decreased activity, and labored breathing. Most people recover in a week or two, but RSV can be serious, particularly for infants, those with compromised immune system, and the elderly. RSV is the most common cause of bronchiolitis and viral pneumonia in babies under a year of age. There's no vaccine for RSV, but a monoclonal antibody treatment can help protect some infants who are at highest risk for severe illness, including premature infants and those who are with an underlying heart or lung disease. Hospitals are already at high capacity and very stressed. And when you add in complications by an early and severe season of highly contagious respiratory viruses, that puts an even greater strain on the system. We're hearing that most pediatric sites, such as Seattle Children's Hospital and Mary Bridge Children's Hospital, are seeing record high emergency department volumes due to RSV and other respiratory viruses. And you can do your part by taking all available measures to keep yourself and your family healthy. Like most respiratory infections, you can help prevent the spread of RSV by covering your coughs and sneezes, washing your hands regularly with soap and water or hand sanitizer, and keeping children at home when they're sick. So in conclusion, this is a time of year where it's so important to protect yourself and those around you from respiratory illness. Get your flu shot, stay up to date on your COVID-19 vaccines, wear a mask in crowded indoor spaces, wash your hands with soap and water or hand sanitizer regularly, and stay home when you're sick. And with that, I'll turn things back to you, Nikki.
Thank you, Dr. Quanget. Next, we'll hear from Chief of Prevention, Safety, and Health, Lacey Fehrenbach. Go ahead, Lacey.
Good morning. Grateful to be here with you all today, and want to express my appreciation for your continued coverage of the pandemic and of other important ways the public can stay healthy and safe. As many of you already know, the use of bivalent boosters was recently authorized and expanded to include children ages 5 and older. This is fantastic news as we head into cold and flu seasons, as well as the colder months where people are more likely to gather indoors and in close proximity to one another. Today, I'd like to focus on why the updated COVID-19 vaccine and booster and flu vaccines are so critical, not only for protecting us from serious illness or death, but also from protecting our already stressed hospital system from becoming further overwhelmed. To start with the booster itself, the new bivalent booster is also sometimes referred to as the updated booster or the Omicron booster because it's formulated to specifically target the BA4 and BA5 subvariants of Omicron COVID-19. These variants currently make up the vast majority of sequenced COVID-19 cases in Washington state. So receiving this new updated booster is crucial as it offers the best protection against serious illness, hospitalization, and death from the current variants of COVID-19 that are around us. It's also the best protection we have against keeping our healthcare system from becoming overloaded. As of October 24th, only 15% of eligible people in Washington state over the age of 12 had received their updated COVID-19 booster. This is concerning because we're rolling into respiratory virus season, and we really urge all Washingtonians who are eligible to make getting their bivalent booster a priority. It's especially important for seniors. While nearly 95% of Washington residents 65 and older completed their primary series, less than 30% have received the updated booster. And that's 30% who are eligible for the booster, just to clarify. As we know, older adults are among the most susceptible to serious illness, hospitalization, and death, and it's crucial we do everything possible to optimize their protection going into the winter months. I do want to recognize that early on, it was challenging to find vaccine and booster appointments quickly. And this is because, as with past vaccine and booster rollouts or expanded eligibility, early demand exceeded our weekly allocation. The good news is that in the second half of September and throughout October, our allocations increased and our inventory levels have caught up. Our state is now receiving weekly shipments of both Pfizer and Moderna bivalent vaccine boosters, and to date, we've received at least 2 million of these updated boosters. The providers across our state are working now to administer them as quickly and equitably as possible. So we urge everyone to schedule, if you haven't, your booster shot, and if you can, please also schedule your flu vaccine with that. Many providers are even offering online the ability to quickly schedule both at the same time. We recommend you start with your usual healthcare provider first, as they may have availability. You can also visit vaccinelocator.org to search for booster availability, and a reminder that that allows you to filter for age groups or vaccine type. You can also call our hotline, 833-VAX-HELP, to speak to someone one-on-one and for assistance in finding options near you, or if you need language assistance. And again, it is safe to receive your updated COVID booster at the same time as your annual flu vaccine. And that is a great way to go into winter respiratory virus season with the optimal health protection. My 2 children are in the 5 to 11-year-old age group that recently became eligible for the updated booster, and they're getting both their COVID booster and their flu vaccines in the next few days. I'm so grateful that they will be well protected ahead of upcoming visits from their grandparents and all of the holiday gatherings that are coming up. So in closing, it's more important now than ever to make sure your home's vaccination status is up to date, whether that means making sure younger children have completed their primary series or anyone in your family who's eligible has received an updated bivalent booster. These vaccines continue to provide the best protection we have against COVID-19. If you have received your updated booster and your flu vaccine, thank you for taking steps to protect yourself and your community. If you've helped others get those vaccines, thank you for supporting your friends and family in keeping themselves healthy and safe. By staying up to date on our COVID and flu vaccines, we keep our families and communities healthy, and we're protecting our healthcare system. Back to you, Nikki.
Thank you, Chief Berenbach. This brings us to the Q&A segment of today's briefing. We only have one reporter who has asked to be in the queue for this morning. So that is Nicole Jennings with Cairo. Nicole, I'm allowing you to speak. Go ahead and ask your question.
Yes, good morning. Are you able to hear me?
Yes, go ahead.
Thanks. We've had several stories recently about major hospital chains really having a lot of trouble due to staffing shortages. Recently, we had the St. Michael's story, and I understand the Department of Health is actually investigating St. Michael's, where people were being turned away from the emergency room with potentially fatal conditions. Now, yesterday we had an exclusive story about Polyclinic as well, and not answering the phones and everything that's been going on there, similar to St. Michael's. We had Harborview a couple of months ago having to close down their emergency room, other than for the most dangerous cases. What is the Department of Health doing? What can the Department of Health do in these cases? And can you tell us anything about the investigations that you're doing, and what ultimately is going to solve this as we see all of these different staffing shortages happen? Is this how healthcare is going to be in our state for the next however many years?
Yeah, thanks, Nicole, and certainly Dr. Kwangat and Lacey, I'm sure will add to this. First, let me start off by saying any active investigations we do not comment on, to make sure that we can continue to go through those investigations and be as fair as possible to all parties involved. So let me not speak specifically to any institution, but I will say that there are common themes that we are seeing and hearing, not just in our state, but across the country, which is really around the strain and the drain of healthcare providers. And that just does not mean the doctors and the nurses. That means the entire ecosystem of healthcare, whether it's medical assistants, but it can also be housekeeping. It could be the people who are making the food, or the folks who are helping patients with certain care needs like medical assistants. You know, there is a whole host of strain that has been on healthcare workers and health workers in general throughout this pandemic. This has been 2+ years of that concern. So I do want to start with saying that is probably one of the bigger concerns that is in the health system, is what do we do with our people who have been really under an immense amount of pressure, both from this pandemic and well beyond. And now when you have people that are returning back into the healthcare system as patients or clients are coming into that system, there's just less people to take care of them. So what you also have then is we have these ups and downs related to whether it's COVID-19 or respiratory season or something else that's occurring in the system. So for example, over the last week, as you know, when we were having the air quality challenges across the state, we had people who were unfortunately affected by that, and they were going into emergency departments and hospitals to be checked out, to get breathing treatments, to get care. So I think there's a lot that goes into why this is happening. But in general, there are some common themes, which are that staff shortages, staff who are having the challenges both from a physical or emotional exhaustion over the last couple of years, as well as the continuation of care needs that are in our communities. So we're working across the system with our other state health agencies. As you know, Department of Health, there are certain things that we do when it comes to licensure and certifications. And there are other things that are very much a part of some of our other state health agencies. We continue to work with them. Some of the issues, as you know, we've addressed before together as a state on taking on challenging patient situations where it's been difficult to discharge patients, the concern about getting people into long-term care facilities or being able to get them into community settings. All of these come into play. So we continue to work with our sister agencies to make sure that we're doing what we can to help them. We're also recognizing the importance of this real messaging to our community, which is, look, this is for some time going to be difficult. This is not going to be easy. So this is why it's so challenging and frustrating at times for public health officials across the country when we say that, look, the pandemic may be in a different phase, but we still need to take preventive measures as community members to make sure that we're being smart about what protections we take, that we get our vaccines, that we keep our mask with us, that we do all sorts of things so that we are at home if we have symptoms or if we have illness. It is so concerning when people are not doing those things, because that ultimately also adds into the healthcare system and the needs that shortage of healthcare workers are having difficulty to handle. So I think it's a multifaceted approach that we are taking. It starts with obviously our communities. It starts with our healthcare system and our providers and the work that they are doing and the administrations are doing to be able to support their teams. And also it's what we as state agencies are doing together to be able to support everybody. But this is going to be a challenging time for the next few months. And let's hope that by the time spring comes back around and the weather gets better, that we will be in a better place. But of course, we can't guarantee that, because this is potentially, as I said, the new normal that we may be seeing for some time, not just in our state, but across the system. Lacey?
I can add a few pieces really specific to how the ending of the state of emergency comes into play here and COVID response. So we do have some limited ability to still provide, mobilize and provide staffing support in some cases. We have done some PrEP Act authorizations that will allow certain provider types to continue doing vaccination and testing efforts. And that is just helpful because it utilizes the workforce that we have to deliver the continuum of services we need to provide. And then we are continuing at Department of Health and many of our local partners across the state in local health jurisdictions, tribes, and community-based organizations, support for community-based testing and vaccination, which, typically in a flu season, we would be doing that, in a pretty light way, but we are going forward with those commitments we made in the WA Forward plan. And then, I think Dr. Shaw hit on this, but the things that the public can do are those tools we've mentioned. So number one, be up to date on your vaccines. Number two, have tests on hand. And if you need tests, the Say Yes COVID Home Test program is still up and running. It's still available. Each household can get 2 packs, 10 total tests per month from the website. You can also use the federal program, which requires that your insurance reimburse 8 tests per covered member per month. And the easiest way to probably access that is to go through a pharmacy. So have those tests on hand. If you feel sick, test yourself. Have a plan to access treatment if you are at risk for severe disease.
Recording stopped.
And that will keep people who can manage.
Recording in progress.
So those are the things we can all do to help protect our healthcare system going into the winter months. The last I'll say that protects flu, COVID, many respiratory conditions. Wear a mask. If you have a cough, please wear a mask when you're out in public. If you're nervous about getting sick, if you're in a crowded confined setting, wear a mask. Your mask, a high quality mask, will protect you, and it'll protect those around you as well.
Yeah, Lacey, you bring up a really good point that I would to Nicole's question, just add one other thing that, whenever we think about getting ready for something, whether you're about to run a race, a marathon, whether you're about to have a football season or a soccer season or volleyball, there is a time where you prepare. There's a time where you get ready before you get into that season. This is our time to prepare. This is our time to do all of the things that we need to do in order to be ready for what's coming ahead. Weather is going to get colder. It's gonna move from rain to eventually snow. We're gonna have people that are gonna be indoors. So everything that Lacey highlighted is absolutely what we need to do today. This isn't let me wait 2 months from now. Let me wait 5 months from now. This is today. These are the kinds of things that we want to do. We want to do them on Monday. when Halloween and our kids are out and about, and when we're thinking about having gatherings. We want to be thinking about this as we get to Thanksgiving and other holiday activities. We want to be thinking about this at the winter holidays. We need to be really thinking about all of the gatherings and all the different things that we need to do today. So if you're thinking about November or late November, you're going to be traveling, or you're thinking about the end of the year, you're going to have a party. The time to get those shots, those vaccines, are today. So you're protected when you get to those situations. You don't want to think about it the day before. That is too late, just as you wouldn't do that before a game to try it, or a marathon to say, let me go now try to run, the 26 miles today. You're gonna prep for it. And that's what we're asking people to do. The time is today to prepare. Nikki?
Thank you. Our next question comes from Elise Takahamo at the Seattle Times. Elise, go ahead.
Hi, good morning. Thank you so much for these continued updates. So I have two questions. First, I know it's really difficult to predict COVID activity, but generally, what are some factors that might determine how long another wave is, particularly for this winter in the Pacific Northwest? And then also with the state of emergency ending Monday, how might residents see that change in day-to-day life, if at all?
Yeah, thanks, Elise. I didn't quite get your second question with the state emergency ending. What perspective were you asking?
Oh, sure. Just how might residents see that change in day-to-day life?
Got it. Let me maybe take that one on first. I would say that for the most part, you will not immediately be really sensing that much change. Now, obviously, there are certain programs and certain activities that are going to be changing behind the scenes. We already talked about WASSERV today, for example, when it comes to the volunteer program that was so successful in our state over the last couple of years. We've also talked about what's going to be happening when it comes to healthcare settings and correctional settings, what related to face coverings moving forward. So I think at present, maybe at the outset, many of our residents aren't going to see that much of a difference. But I think what you are going to sense over time is that we are going to increasingly amp up our concern for respiratory season and for virus season, that we are going to increasingly say, this is the time. And hopefully the ones like Olene that was there at CWU this past week in Ellensburg, they're already taking matters in their own hands, and they're getting their COVID vaccine, they're getting their flu shot. There are others that are getting their home tests, and they're getting on the website and making sure that their COVID tests are delivered to their home. There are others that are making sure that they're having conversations with their kids about, look, when you're getting into this fall season or winter season, you're going to have folks, other kids in your classroom that may be coughing, and what are you going to do if that happens? There are a number of things that we will start to ramp up those messages and make sure that people are recognizing the importance that we're not completely out of the woods here. We have to continue to work together. So I think that's probably the biggest thing, Elise, that we're going to be really doing, and what maybe residents are going to see is there's going to be a sense of that. Look, we're in this. This is potentially going to be a difficult season coming up. It hopefully will not be as difficult as we've had over the last couple of winters. We believe that vaccines are helping protect us from having that kind of a surge. But at the same time, as you heard in the previous question, we're also having problems and challenges that we've got to be thinking about in our communities, including what's happening in our healthcare system. So it's going to take all of us to work together to be able to be successful as a state. And again, I want to join Lacey, and as she thanked everybody, because this is really about the gratitude to Washingtonians for rolling up their sleeves or pulling up their mask or making sure that they, dial the number to figure out where a vaccine is, or to make sure that they get a home test delivered to their home. These are the kinds of steps that we want people to prepare for as we get into the later parts of this winter. And certainly the forecasts are that this winter is going to be possibly more precipitation and colder in the Pacific Northwest, and we want people to be thinking about that. As for your first question, I'll make a quick comment. I'll turn it over to Dr. Kwan Get. My quick comment is that, we are hopeful that, again, that as we're looking at the variants that are here or on the horizon, that our vaccine efforts, and also just the fact that we have more, including natural immunity, that there is really less of that concern that we're going to have these big spikes. Now, that doesn't mean that it can't happen, but we're hopeful that we don't see it happen, that there's some cross-reactivity or cross-protection when it comes to our both immunity from either vaccines or because of previous exposure to COVID-19. But what the challenge that we're going to have is really the other viruses, as you heard with RSV and influenza. These are the challenges that we're also watching. So now it's this may be the first season in a couple where we're not going to see as much masking happening across the system. And that is the concern, that we may see more of those respiratory diseases and the transmission that goes along with them. So hopefully that helps. And Tao, if you want to add anything to that.
Thanks. As you mentioned, nobody has a crystal ball, and we can't predict the future, and we can't predict, the course that the COVID-19 pandemic will take. But I think it is important to be prepared for the possibility of another surge, another wave, and in fact, we're seeing some countries in Europe reporting higher numbers of cases, and that could happen here in the United States. As far as factors that could determine the size and the duration of a wave, some of them are beyond our control. Some of them would be related to the characteristics of a new subvariant that becomes dominant. Right now, the dominant subvariant is the BA.5 subvariant of Omicron. And there are a number of subvariants that make up a much, much smaller proportion of cases. And they're all more transmissible than the original strain of COVID-19, of SARS-CoV, the virus that causes COVID-19. None of them are showing signs of emerging as the next dominant subvariant that will cause a surge. But it's something that we have to keep our eyes on, and it certainly is possible that one of the subvariants or a new subvariant that hasn't yet been detected could increase and become the dominant subvariant and cause a new surge. So that we don't really have control over. What we do have control over is the amount of population immunity. And the way we increase population immunity is through vaccination. And that's why the new updated COVID-19 booster is so important. The new updated booster, as Lacey mentioned, is especially formulated to have more activity against the Omicron variant. It contains components that are against two versions of the spike protein, one of the original SARS-CoV-2 strain and the other of the Omicron strain. And it's likely that any new subvariants that threaten to cause a surge will be more closely related to the Omicron strain than the original SARS-CoV-2 strain. So by getting the new updated COVID-19 booster, your immune system will have a much better chance of fighting off one of the new subvariants should they make their way onto the world stage or into our communities and cause a new surge. So the more people that can get the updated COVID-19 booster, the more people we can keep out of the hospital, the more lives we can save, and the less severe and shorter duration of a surge. So though we don't have control over the characteristics of the new subvariant, we do have control over what proportion of our community can get the new updated booster and get vaccinated. And that's why it's so important for everybody to do that.
Thank you, Tal. Appreciate that. Lacey, anything that you wanted to add?
I think you both covered it.
Great, thank you. Nikki?
Thank you. This concludes the question and answer segment of our briefing. So we'll go back to Secretary Shaw for some closing remarks.
Well, thank you both to our team, again, Nikki, as well as Tal and Lacey for joining this morning, and also the team behind the scenes that you don't always see. Just want to thank them for the incredible work that they continue to do. 2+ years in, we're still talking about COVID-19. So I think that it's a telling sign that we are continuing in this journey together. And as I said earlier, as long as we continue to work together, there is nothing or no limit to what we can accomplish as a state. I also want to thank all of you, our media partners, for being here today. I think the key message for us is the fact that this is the time to take the action. This is not the time to think about it. This is the time to take the action. There are some concrete steps you can take: getting vaccinated with your flu vaccine, getting your booster for COVID-19, to make sure that you've got your masks ready in case you get into a situation where people around you are sick, or you're concerned about getting some respiratory virus or respiratory illness from those around you. This is the time to order your COVID-19 test. This is the time to do all the things that you should be doing or can be doing, or this is the time to say this is what we all should be doing together to be able to get ready for the winter season ahead. So we hope that you will do that. We also want to remind everybody that it is Breast Cancer Awareness Month, and as we get to the last few days of this month, we hope that women and men are appropriately doing their monthly self-exams, and also they're checking in with healthcare providers to make sure that they're appropriately being screened. And that is such an important message that we don't want to miss. So today has been a day about prevention. It's been a day about protection. It's been a day about looking ahead, being hopeful for what is ahead, but also making sure that we're doing what we can do together to be able to, again, protect our communities. So I hope you will join all of us in doing that. Please have a great Halloween on Monday. Make sure you look at our website for any of those tips on health and safety and prevention and protection that we talked about. And I bid you a great rest of the day. And with that, I will turn it back to Nikki.
Thank you, Dr. Shaw. This concludes today's media availability. I'd also like to thank our panelists for their time today, our media partners for their continued coverage of public health in Washington State, and TVW for hosting today's live stream and archives of past briefings. This concludes our briefing today. Thank you and take care.